why do you stop breastfeeding, or what should you do when you go back to work if you're continuing to breastfeed? Now, the biggest piece of advice I can give to anybody in this is not to go cold turkey. And what you decide to do is entirely up to you. There are lots of people who do return to work and continue breastfeeding, continue expressing, and their babies do adapt to that. A lot of babies will do something called reverse cycling when you go back to work, and that is where when you are with them in the evening and in the early hours of the night, for example, is they will feed a lot more when you first return to work. That will change, that will adjust, that will get less as time goes on. But in those early days with that transition, it can really help the babies emotionally regulate, particularly with the big changes that are happening when they go back to childcare. So that is where you will feed when you are with them, but they will get used to not having you once they go into that childcare facility or setting. Just a little bit of a warning, personal experience here, it may mean that you get a few additional sleepless nights. That's the only thing to be aware of. But that doesn't happen for all people, and it does depend on how long you are away from them. For me personally, I was working 12-hour shifts, particularly when I went back with my first, so that had a big impact on them being awake all night. And the actual logistics of returning to work may mean that you need to express when you first go back to work. Now, the factors to decide whether or not expressing to make yourself feel comfortable, to reduce the chance of blocked ducts and mastitis when you first go back to work, will depend on various factors. So firstly, how often is your baby currently feeding when you return to work? How long are your shift patterns or your working patterns? It's very different if you're only going back for 4 hours of a day, for example, where actually you could breastfeed before and after it to make your breast feel more comfortable, compared to someone who's working 12 or 13-hour shifts, for example, where you are going to need to do something in that time. And expressing could be hand expressing or pump expressing, and it may also depend on the age of your baby when you go back as well. And you might want to consider being able to express so that that baby then has, on the next time that they go to nursery or childcare setting, a bottle of milk or a cup of milk that you can give to the childcare setting or facility to give to your baby, and then you're not wasting that milk. And for the majority of people who continue breastfeeding, they find that they only need to express for the first few days or weeks, because the breast will naturally adjust to your transition back to work, and so that engorgement and that fuller milk supply won't feel quite so bad when your breasts have adjusted to that. Personal experience, first time round, I only expressed for the first couple of months and then they really adjusted. Second time round, it was much quicker. I only expressed for about 4 to 6 weeks on returning, and then that was it, back to normal. So if you do want to end your breastfeeding journey, that's absolutely fine. Support for you is the biggest thing. There are several things that I will recommend and suggest, but individualised advice is obviously always better if you can get it. The National Breastfeeding Helpline is a fantastic resource. Give them a call, they'll be able to talk you through step by step, and they'll be able to help individualise any plan for you for reducing your feeds. Gradually weaning will reduce the chance of blocked ducts, which can reduce the chance of mastitis, which is an infection of the breast, which can also help to reduce the chance of something called an abscess that sometimes needs surgical removal and surgical drainage if it were to happen. So gradual weaning is the recommended route to be able to prevent all of those problems. And that's without even thinking about the psychology for both you and your baby as well on that return to work. So one of the other issues of stopping suddenly is that your hormones will take a complete plummet and crash, which can lead to an increased chance of things like depression and anxiety, low mood as well. And for baby, breastfeeding is more than just nutrition. It's also emotional connection and emotional regulation. And for people who suddenly stop breastfeeding, sometimes that can really have an impact on the baby and the toddler. And so gradually weaning is safer from both a health perspective but also emotional perspective for both mum and baby. And it's why almost every single national guidance recommends gradually weaning. So with gradual weaning, you're going to drop a feed a day for 3 to 7 days at a time. So if your baby would naturally get up in the morning, maybe the first feed you want to do because it makes you feel the most comfortable, maybe on the next feed you offer a snack, for example. You do distraction techniques, you take them out, you offer them a bottle, you offer them a cup of drink, whatever it is that you're going to do. You remove that feed, and then after 3 to 7 days, when your breasts aren't feeling so engorged because of the gap that you are having now between those feeds, you then drop another feed, and then a few days to a week later you drop another feed, and bit by bit you are reducing those feeds. Now, if you are exclusively expressing, what you would do is start dropping either an expression a day, again for a couple of days, wait for that to feel better, then drop another one, and so on and so forth. Alternatively, start shortening the length of time that you are expressing for. So if you normally express for 10 minutes, you express for 5 minutes from a comfort perspective. And then what you do is you gradually reduce that amount of time over time. And gradually weaning for some women actually enables them to continue breastfeeding for a bit longer as well, from a nutritional perspective, from a health perspective, from a mental well-being perspective, particularly if it gets to a point where you're feeling touched out, you're feeling overwhelmed, you're feeling like, oh, I don't think I can do this anymore, particularly if they're going through that clingy separation anxiety where they're constantly on you stage, usually somewhere between about 8 and 12 months on average, although it comes and goes and fits and starts as does anything children related. But for some mums, they find that when they do cut down and they've started to gradually wean, they find that when they do feed their babies at set times, sometimes maybe before bed, for example, maybe it's that first feed in the morning before they go to work, whatever it is that they feel is the best way going forward. For some mums, it does help them feel more connected to their babies, and it means that they've cut out a lot of the feeds, but they just have that 1 or 2 feed a day until either the baby's ready to stop or until that mum is ready to go, yeah, I'm done with this now. I'm now going to tackle this next feed and finish that feed. And other things that can just help with reducing milk supply as well. Cold compresses in between feeds, that just helps with reducing the engorgement and also helping to try and inhibit some of that milk supply. And peppermint tea in high amounts also can help to dry up the milk supply a little bit better as well. So this might be something, if you drink a lot of peppermint tea, you might want to consider alongside doing the gradual weaning as well. So it's not to be used on its own, but it's just another thing that you can try when you are gradually weaning. And under a year, you can replace with first stage infant formula either in a bottle or a cup, or alternatively, if your baby is over a year old, this is where full fat cow's milk drinks come in, or alternatively a fortified growing up milk for your baby. And over a year, you would just put this into a sippy cup, a straw cup, an open cup, whatever you are going to plan on using. You don't need bottles at that stage. And if you are replacing over 6 months old, you can just put it straight into a cup. You don't have to use bottles should you choose not to. Some babies never have bottles, and that is okay, and it's not going to hinder their development, and it is not going to necessarily cause a problem for that individual person. It's about what is right for that family.